Okay, so today we are going to discuss markings of syndactyly repair. There are many methods described for syndactyly release. We follow what is commonly done called as dorsal flap technique. Okay, so look here, he is a 7-year-old boy who has syndactyly between index and middle and ring finger. So by rule, we'll never release one finger on both sides. So we'll be dealing with index and middle finger release today. After 6 weeks, we can release this. Okay. So now what type of syndactyly is this? This is incomplete because it is not reaching up to the tips of the finger and only skin is involved. No bone is involved. So it is a simple. So it's a simple incomplete syndactyly of index and middle finger. Okay. Syndactyly means fused fingers. So what we do, we mark first the knuckle points. Okay. Two metatarsal heads and the midpoint on dorsal side of the fingers. So never dissect beyond the midline, never dissect. And then mark the PIP joint. So the dorsal flap is 2/3 length of this length. So dorsal flap is marked, which goes into the web space. Then we incise this fold in a zigzag manner. So this is a zigzag incision. Then we go on the volar side. On volar side, no need of dorsal flap. Again mark the two metatarsal heads and have a little triangular flap, or a flap may not be taken, but we take a triangular flap and mark this zigzag as mirror image of this zigzag. So it has to be exactly mirror image, so that these flaps, when they turn in, they cover the fingers. Now in this case, it again mark the midline. Now in this case, it is unlikely that he will need a skin graft because a lot of skin is available. But suppose patient has a shortage of skin, then we can take skin graft from the wrist crease, a full thickness skin graft, or we can take a split thickness skin graft from the forearm. So this surgery in this child will be done under GA and under tourniquet. He needs a tourniquet. Okay. So total duration of surgery will be 1.5 hours. Chalo, done.